Hey everyone, this is Dr. Matt Sherwood with Sherwood Spine and Sport. This next series of videos, we're going to be going over everything to do with neck pain. So we will be going over specifically in a couple videos the two most common causes I see for neck pain, which are a disc protrusion or a disc bulge, and then also if you get arthritis in the neck and that starts to hit a nerve. You can have just some irritated joints, you could get some trigger points, you can strain something, but the most common I see by far are those disc injuries, and then just the arthritic change causing some nerve irritation in that neck. So a lot of the times, the big misconception I see with the neck is people lots of times won't have pain actually in the neck itself. It'll be like in the shoulder blade region or the upper back, and they think it's a muscle or something else, so they'll roll it and they'll push on it hard and use a massage gun and use all kinds of things in there, neglecting the neck. And then the issue with that is not only can you irritate the stuff you're badgering over and over, is if you have a nerve or a disc injury up there, it can get worse, and then you can start having significant problems, and then it's harder to treat. So an easy way to just check that out is if you're having pain in the shoulder blade, you're not sure, if you move your head, particularly if you move the head up, you look up and you rotate toward the side of the pain, and that seems to make it worse, then it's definitely from your neck. There may be some situations where it's not, but 95% of the time it's going to be from your neck. So that you have a neck problem, you're going to have to get that checked out. It could be, like I said, in the shoulder blade. Sometimes just the arm will hurt. So you can think it's this deltoid just strained it working out or something, but it's just this arm that's burning and killing you, especially when it's hanging at your side. Well, a quick way to know that is if you move your shoulders and it doesn't seem to hurt, but you move your neck and you look up and you look to the side and that makes your shoulder worse, then it's definitely your neck is involved in some way. Doesn't mean you don't also have a shoulder issue, but the neck is definitely involved. So when I see someone in the office with that upper back pain, until I'm completely 100% ruled, convinced otherwise, it's from the neck. So we'll do some check range of motion. We'll do some orthopedic tests. There's only a couple that are pretty good for the neck. We'll check the joints in the neck and upper back and ribs, see if those are moving properly. We'll do our neurological exam. So we want to make sure that we don't have any weakness in the fingers and the hand and the arm that would indicate a nerve is really getting compressed, and we might need to take further action about that. And then usually based on our exam, we can usually have a pretty good clue of, are we leaning more toward, is this just a joint that's irritated? Is the patient older? Does he maybe have some arthritis and a nerve's getting pinched? Or did we more injure a disc and we have that going on? So we'll usually decide on a home exercise, go over that, do a little bit of treatment in the office, send the patient home with that home exercise, and the follow-up visit, depending on the response to that exercise, it helps to pin that down a little bit. On occasion, I will order x-rays. It depends case-by-case basis. So if the patient is older, let's say over 50 years old, they've never had x-rays before, they had x-rays a long time ago, they were involved in a trauma, history of cancer, things like that, x-rays are warranted. If the patient is 25 years old, their exam's pretty normal. Even if I suspect a disc thing is going on, we're not going to order x-rays for that. If we do some treatment and they're not improving in a couple weeks, then we can always order x-rays, but we can't see discs on an x-ray. So we're not going to be sending for x-rays just, for the heck of it in that situation. The subsequent videos here will kind of break down the disc condition and then the arthritic condition, give some exercises to do for home for that. And then the last video, we'll go over once the pain is getting better, your pain is pretty much absent, we'll go over some things that try to prevent the neck pain from recurring over and over again. Maybe we'll have to check and screen and work on some shoulder mechanics stuff, but typically it's going to be working on stiffness in the mid to upper back, working on our posture, working on strengthening the deep muscles in the front of the neck. So that's what we'll go over in the subsequent videos.